All right. As people are coming in, feel free to go ahead and introduce yourself in the chat. Maybe say your major, what school you go to, where you're from, that sort of thing. We're going to be here for an hour and 90 minutes, so we might as well get to know each other. So to start, I'm going to be one of your co-moderators today. My name is Mary Jonas. I'm an undergraduate student at Drake University, and I'm a student intern at IPHA this year. I was connected to IPHA through the AmeriCorps program at Drake, and I've gotten to help out with a lot of cool things at IPHA, including the conference.
Felicia.
Hi, my name is Felicia Pieper. I'm a Master's of Public Health student at the University of Iowa. I've been on the conference planning committee this year, and I'm really excited to get started today. I'll be your tech monitor, so if you have any issues, feel free to message me, but that's my role for today.
Thank you. And I'm Janine Moody. I'll start it off by saying I'm a student at the University of Illinois, Chicago, working on my doctorate in public health leadership. And my day job is as an instructor here at Des Moines University in the Master of Public Health program. And I get to work with students on those culminating experiences and bridging them into practice through internships or capstones. And I'm so happy to see some of my students from around the country, see their faces on the screen. I'm delighted that they could cross time zones and join us here in Iowa. And I'd like to introduce Dr. Richelle Reimer, who is the chair of the Department of Public Health at Des Moines University, and DMU is sponsoring this session and the student participation in the conference.
Hi, good afternoon, everyone. Like Janine said, my name is Richelle Reimer, and I currently serve as the chair of the Department of Public Health at Des Moines University, where I have the pleasure of overseeing not just our public health students, but also our healthcare administration students. And I'm so pleased to be here as we kick off National Public Health Week and the first day of the Public Health Conference of Iowa, where my dog is snoring right there. So if you can hear that, that's my dog. I'm so excited to be here as we sort of kick off National Public Health Week and the first day of this conference, and we reflect on an historic year behind us and a future that involves collaborations across sectors, regions, and importantly, intersecting professional backgrounds. Today's event is focused on non-traditional career paths, and this is a perfect session for Des Moines University and our program specifically to be sponsoring, because my own personal professional experience and that of many of our students is that we have not taken predictable career paths. I come from a background in social psychology, where I studied individual health behavior, and that brought me into public health. And now I get to have my feet in many different camps, which sometimes leads me to feel like I'm not actually in any camp, but hopefully our session today will help us all see that regardless of whether we've got 1 or 2 feet in the realm of public health, we're all going to be doing that. So I'm excited for us to think creatively about who our public health colleagues are and how we can engage with them, and envision a future of rich and creative partnerships that will bring more professions and colleagues to the public health table. So thank you for having me here today. And I'm going to sit in for a few moments, and then I actually am double booked in another conference, and I'll hop off, but thank you.
All right, awesome. So on behalf of DMU and the Public Health Conference of Iowa, we welcome all of you to our student networking session. So today we have invited 6 professionals to come and connect with you and speak with you. And so first off, thank you so much to all of our speakers who have joined us today. It means a lot that we get to pick your brains and get all of your wisdom. So thank you. And before we get into the actual networking, we're going to give our speakers a chance to introduce themselves.
So let's start with Tony.
Hi, I'm Tony Leys. I'm with the Des Moines Register. I've been here since 1988 and a reporter since 2000, an editor before that. And I mostly cover healthcare and then whatever else they need from me, including politics sometimes.
And Mike.
Afternoon, everyone. My name is Mike Armstrong. I'm the Director of Planning and Communications for the Street Collective. That is a Des Moines-based nonprofit that is all about trying to get more people to walk, to bike, and to ride transit. So we do community empowerment, engagement, advocacy. We run the bike share system. We do a lot of these little pieces that build up into these larger areas of sort of cultural, societal change. My background is I'm an urban planner. Went to school at Portland State University. I've been in Iowa for 8 years now. I've worked in government, in nonprofit, but I've been with the collective for 3 years now and still going strong.
Tinika?
Hello, everyone. My name is Tinika Roland, and I am the Community Health Worker Certification and Community Health Navigator instructor through Iowa Chronic Care Consortium. And I also work for Des Moines Area Community College, the urban campus. I am the orientation coordinator there and the outreach coordinator. And an academic advisor, so do a little bit of everything.
What's your favorite hat there? There was a lot of hats.
You know what? I do thoroughly enjoy the orientation along with outreach. That's just, just that networking and that partnering, and I get to, meet new people all the time. Well, before the pandemic, I was able to meet people in person. Now I'm meeting people like this virtually. So yeah, this is a great opportunity. So thank you for including me.
Delighted, thank you. And Katrina.
Good afternoon, everyone. I am Katrina Carter, and I have been with the Iowa Department of Corrections almost 22 years. Right now, my role is Director of Reentry and Programming. So any of the programming that takes place in the institutions or the prisons, I have oversight of that. And then, of course, with reentry, absolutely rely on our community partners and other state agencies, nonprofits, volunteers, faith-based organizations. We all share the same clients, and not one of us can do this alone. So I'm very excited to be here today, and looking forward to learning from all of you, as well as sharing what I can. So thank you.
Thank you. And Brian.
I'm Brian Finley. I am a web developer for the university, application developer for the University of Iowa. My background, my degrees are theater, journalism, and library science. So naturally, I started a Twitter to help people get vaccines, and I found myself here. I feel like the pretender in the room because I'm just a guy in his basement, but I'm excited to sort of hear and learn and see what everybody's got to say.
Okay, first of all, almost everybody's a guy in his basement this year, so that's nothing special. But I think a lot of folks will echo that. Not quite sure how you came to this career. And I just want to call out, did you say you have a degree in library sciences? Oh, do we lose the guy in the basement? Wait,
I can't hear you. Am I the only one?
Can other people hear me?
Yeah, I can hear you.
Yeah, no one can never not hear. Yeah, that doesn't. Oh,
I can hear both of you.
I thought Brian said he had a degree in library science, and so I was going to kick it over to our friend Hannah. There's been a lot of really robust work from the Midwest Public Health Training Center and highlighting the intersection of librarians and public health professionals and opportunities there. So if you're not plugged into that, we should make a connection. And then finally, Kelly.
Hi, everyone. My name is Kelly Sittig. I have the pleasure of serving as the executive director for an organization called the Iowa Cancer Consortium. We are our state, so Iowa's Comprehensive Cancer Control Coalition or partnership. And we are charged with basically connecting folks who are working in some form of cancer control, all the way from prevention through treatment, screening, quality of life, anything that's encompassed in cancer control. We're helping folks connect with each other, find resources, build their capacity, basically all as a way to work collaboratively to reduce the burden of cancer here in our state with a bigger impact. My background is in public administration and music. And I'm currently in school, actually, so I'm a student too, not in public health, but in organizational psychology, which definitely relates to anyone's work, whether it's public health or any other work as well. And I too am really looking forward to today's conversation and learning from all of you. Thanks so much thanks to IPHA and thanks to DMU for having us today.
Okay, music, that might win. I love that. And organizational psychology is kind of the crux of much of the curriculum that I'm working on for public health leadership, Kelly. So it's probably a lot of intersection. So let's just have a quick shout out in the chat. What was the most bizarre thing you heard from our guests about their accidental intersection with a public health career? Anything that's striking our attendees as most intriguing that you'd like to hear more about, maybe?
One thing that I didn't share, this is Tinika. My undergrad degree is in fashion design, apparel design from Iowa State University. But then my master's is a master's in business leadership with an emphasis in quality management and human resource management. So a large part of my career has been human resources in corporate America. But of course, we know there's transferable skills, right? So I'm sure we'll talk about that a little later, but yeah, my passion has always been fashion. So I initially was in the fashion career. I do have a home-based fashion design and t-shirt design with scripture based, but I don't do it as much just because I'm always doing other stuff. So, but yeah, I just wanted to, I didn't know we were sharing that part, but yeah, fashion, I still love fashion.
This is like an informal networking cocktail hour. So everybody could share all the things. That's kind of what we're going for, right, Mary?
Well, and I will jump in then. Undergrad is from Iowa State University in Women's Studies and Biology. Imagine that. And then my graduate degree is from Drake University, go Bulldogs. And that was in rehabilitation administration.
Tony hasn't revealed anything. Clearly, what's your deal?
What's my deal? I actually was an economics major in college at the University of Wisconsin. And it didn't occur to me until I was a senior that I should check to see if that was something that I actually wanted to do for a living. So, and I wound up, unlike most people in journalism who did it all through high school and college, I wound up joining the college paper just to help out a couple friends who were in a jam and needed some help. And it was so much fun.
Which UW?
Wisconsin, Madison.
Madison, okay. Cool, interesting. Okay, what have we got going in the chat here? What's interesting thing people have heard so far?
So can I respond to something that Tony just said?
Yeah.
That I feel like is a big elephant in the room of we're all doing different things than what we started out doing. And that is the pressure that exists for 18 to 22-year-olds to know what they want to do with their lives. And that I think we could have like this big like educational revolution where we stop doing that and give them a little more space and time, whatever that looks like. Because I think I have a almost 16-year-old and she has a lot of brain development to do. And don't we all at that point, we're different people when we really start to get into our careers than we are when we graduate from high school. Anyway, so I just appreciate that statement so much. It's familiar.
Well, and it's become, I was able to go on a 5-year plan without a whole lot of trouble. I mean, my parents were a little disappointed, but it's so much more expensive now. Like to make that call at the last minute and go take another year of college. You can't just do it as easily. I feel really lucky that I could.
All right. Well, now that introductions are over, I'm very excited to say that there are a lot of cool people here that I'm interested in hearing from. So now I want to remind our students that part of this session comes with the opportunity to connect with a professional for a one-on-one deeper career conversation with someone either from the Iowa Public Health Association or the Iowa Environmental Health Association. And we will get you connected to a professional. So we're going to be sending out a Google form in the chat. And if you're interested in that opportunity, go ahead and fill it out. Okay, and then so for our next section of this session, we are going to start off with a Q&A. So feel free to direct questions to specific speakers or general questions to everyone. And we are also going to ask that you put your questions in the chat and one of the moderators will read them out.
And we have a question up our sleeve to get the ball rolling, but we'd really rather not be the ones asking questions. All right. You should pull it out, Mary. In the meantime, start and guests can ask each other questions as well.
All right, I'll start us off with a question to get the ball rolling. The question is, if you were going to change careers and devote your time to one public health issue, what would it be and why?
So Katrina, why don't you start?
There are so many areas to choose from. I serve on a committee that looks at, unfortunately, domestic abuse deaths. And so that has always been a passion of mine, people managing themselves in a healthy fashion in relationships. But whatever public health I could do with babies, I think I would enjoy. They're fresh and new, and it represents hope. And so I'm just throwing that out there. It might be a retirement something, maybe I just rock them, but something with hopefulness.
Who's next?
I can jump in there. It's always strange, like if you're not currently in a different public health field. I think one of the ones that jumps out to me and is depaving. The places where we live are so covered in concrete and asphalt that there have been some really cool organizations that have started up on purchasing land and tearing that up and either doing urban gardens or just green space, natural habitats. Like, I'd love to read up on what sort of plants would flourish and trying to put those pieces together. And I don't know if I have a green thumb or not, but I would find out.
Who's next? Kelly?
Sure. There's a lot that I would love to do. If I were to stay specifically with cancer, I think anything focusing on prevention, because that is a place that we have the ability to make just a huge impact in quality and quantity of lives. But I think that I would also love to be a person who works directly in and with like smaller towns or mid-sized towns. So I live in North Liberty right now, to really focus on city policy that can affect health of community members. I think we elect folks and trust them to do their best, and they do their best, but just like those of us who have learned new things that we didn't expect to know. We all have a lot to learn, and most of the folks who we entrust as our city leaders are not educated in things like public health. And so I think I would just love to do something more with the crossover of public health and policy, maybe in community settings.
Tinika.
Let me just say this. I can't just choose one. Just because I'm an outreach person. So I want to have opportunity to get out in the community, and I'm an educator too. So, and I've done work in various different areas, and actually that's how I had the opportunity and the pleasure to work with Lena with Count the Kicks. And so I did outreach with Count the Kicks, the faith-based portion of that, to help educate the African-American community about stillbirth. I've done breast cancer awareness through Polk County Health, reaching out to the African-American community. So that's one reason why I can't pick one, because there's so many areas that are prevalent, and we know public health exists, we know it's important, but until it really touches you personally or indirectly through a friend or a family member, then the level of importance becomes different, if that makes sense. Cardiovascular, heart health is extremely important to me. I have a son that's 25 years old, and he lives with an LVAD, which is a left ventricle assistant device. My son needs a heart transplant. And he found that out when he was 21. And it's genetic. And I carry the gene and didn't know that I carried the gene. We only found that out because my son was having troubles breathing. And he also has an ICD that he lives with as well, that's under his left arm. So there's just so many different areas. Cancer has been really prevalent in my family. My dad has had it 3 different times, breast cancer, bladder cancer, prostate cancer, other family members. So any way that I can be used in public health issues to educate, because like Kelly mentioned, prevention, there are so many ways that we can prevent a lot of these chronic conditions that many of us, we don't know how to access the information. We don't really know who's who in the community or how to even just do the right things. We know we're supposed to do the right things, right? But we don't always know how to do it. And sometimes it could be just through what we're eating, just through active living, not being, sedentary. And now that we're at home, many of us are at home and not going back into the office space. Many of us are sitting on Zoom calls and we're teams and all that, and we're sedentary and we're not moving, and so that impacts us as well. So that's why I say it's just so hard to choose one. But if I can get out there and do outreach and educate and learn myself more on a lot of these issues. And like Kelly mentioned, the public policy piece, there's so much red tape, as many of you know, and I know Brian had mentioned earlier that might be one of the reasons why, some of these large companies didn't even create the opportunity to learn about, where to access the vaccine. That's a whole nother piece. And then the misinformation, that's another thing. There's misinformation about the vaccine and misinformation about so many chronic illnesses and chronic conditions that we need more people to get out there and to be able to share the information.
We are all policy, yes, and more voices. And that's the beauty of having people like you all here today who aren't necessarily traditional public health people, but the bigger the tent, the broader and more amplified the voice. So thank you. We do have some specific questions. Oh, and Hannah's inviting you to the IPHA Advocacy Committee. Yes, do that. Tony or Kelly or Brian, anybody want to, or anybody who didn't address that question, want to take a crack at it before we move to some things in the chat? Or Kelly, you did already. Sorry. Like, Tony, what's your favorite thing in public health to write about?
I think one of the most encouraging areas is on mental health, that when I first started writing about it, no one wanted to talk about it, especially no one who was doing pretty well with it. Like the only examples we ever wrote about were when things went totally off the rails. No one wanted to be identified as having a mental health issue, but finding a way to cope with it, which is, you know, so important to show people models of that. And that's really changing. It's really encouraging.
Thank you for that, because I think that's very important with the mental health, because there's a major stigma regarding the mental health. When I used to host a radio show, it was called Rockin' and Rollin' to Better Health, with Mercy One and Miss Jackie Easley, those of you that may be familiar with her, in 2016. And that was one issue that we addressed. And especially in certain communities, it's a major stigma. It's like, what goes on this house stays in this house. You don't talk about it. And you know, if you feel that you need to speak to someone, it's like, oh, we don't do that. You know, then you get those labels and those terms that are so negative and condescending like crazy, you know, those type of things. And so as part of several different forums a couple of years ago, called Code Red, if you're familiar with that. And Code Red, the red piece meant restoring everything damaged, and the NAACP started having several different forums about mental health, you know, in different places and different spaces here within the Des Moines community, but they haven't had that since the pandemic. So I applaud you, Tony, for that. Thank you. I hope you continue writing about that. And like you said, to talk about people that are managing it well and doing well with it, because I think even with this pandemic, it's impacted my mental health. And I think many people in our students, like I said, I volunteer with high school students. Our students have been impacted by this. And so I think this is something that we need to talk more about. So thank you for that.
I'm going to ask, some of the presenters are getting specific questions to them. If you'd have a look at the chat, and since we do need to go into our first breakout room here in a minute, if you can maybe respond directly in the chat. And I do want to put up one more question, because we have just a minute before we go into breakout rooms. And that question's from Rachel Doggett. And she'd like to know, how do you see your work in the US having crossover with global health efforts and or refugee communities that are here in the United States? That's a big question. I'd like to take a go at that.
You can give an early shout. I don't think it's going to be the way that most people do, but for the US, the way that we've done sort of transportation, how we plan out our spaces, our towns and cities, has been pretty static over the last 60 years. And it hasn't worked out very well by pretty much any metrics. So it's been really interesting for us. We do a lot of looking at how global communities are addressing some of these issues. You know, we working with public health, like we want people to be able to walk. And part of that is where you live. Like, does your zip code allow you to walk? Like, are there sidewalks? How wide are the roads? Is it, you know, trying to sprint across 45-mile-per-hour streets in order to get to the grocery? And so we do a lot of looking at what, especially older cities, because they were built around people walking from the get-go, as well as newer cities, especially in sort of the Southern hemisphere of like developing cities that are doing a better job of this. And on the flip side, what's been really important for us is not just interacting with refugee communities to find out what they need, but also pulling ideas from them because they are coming from countries that have implemented different solutions to these problems than we have in the US. So there's a lot of knowledge and creativity there that we can tap into so that we stop trying to put the same band-aids over these problems again and again.
I can't take my eyes off the chat. What going on there? Okay, Mary, do you want to take us into the next section here?
Sure,
Like,
yeah.
keep using the chat. That's like the beauty of this. There's no crosstalk. Everybody just keep chatting away. It's fine. Totally
Yes.
acceptable.
All right, so now we're going to move into our first breakout room session. We're going to have some prompting questions to help guide the conversations. Feel free to go through the questions. Feel free not to use them at all. Just let it flow. Just do whatever you feel like doing. And Felicia is going to explain how that's going to work.
Yeah, thank you, Mary. So we have 6 guest panelists today. So we're going to go into 6 breakout rooms, and you'll stay in those breakout rooms the whole time, but we'll move 2 times. So you get to meet 3 different speakers, and then we'll come back together at the end. And I think we're ready to go. So I'll send you off. You can always come out, leave your breakout room and come to the main room if you have questions, issues, if you want to talk to someone. But other than that, we'll see you in about 10 minutes.
Sherry and Kelly and Allie, are you there? Hey, Sherry, how are you?
I'm good.
Good to see you. You want to go to a breakout room?
I didn't get invited to one.
What? I don't know how that works. Hey, Felicia, do you know how to? I mean, I'd love to talk to you, but you didn't talk to me.
I was waiting to, don't you get invited to one and you click on it?
Only the cool kids. Only
Yeah.
the cool kids.
I was late to the game, so maybe that's why.
Felicia's the master of all this. She'll figure it out in a second.
I'll get you there in a second. Sorry about that, Sherry.
Oh, that's all right.
By the way, Felicia has the best radio voice ever. You should do a podcast, Felicia. Allie, are you there? Or Kelly, are you there?
I am. I'm also having.
Okay, no worries. We'll help you. You want to go? Felicia will help you. She's, this is where I'm just, I mean, I could try, but I'm afraid I'll like break all the breakout rooms or something. I don't think I should do it.
There I go. See ya.
Okay. And with Kelly, are you there?
Hello, can you hear me?
I can.
Okay, I'm having some technical difficulties, it seems. My Zoom.
Oh, we lost you, Allie. Try again. Oh, she's gone. Okay. Kelly?
How long are we letting these ones go on for? Was it 15 minutes?
This is 10 minutes from 4 to 4:15. And then we start the second one at 4:15. I'm not sure. Kelly, are you there? Maybe she logged on and then had to step away.
Yeah, it looked like she got invited. So I'm thinking it's either technical or she stepped away.
Okay.
Yeah, and I think there were some questions we didn't get to, and I left time in the wrap up for more questions, so I can just pop those in at the end if we have time.
Thank you.
Good questions, though.
Yeah. I'm sorry. I obviously am terrible about letting people just be quiet.
No, it's great. It's great. No awkward silences.
I'm okay if it's just like you and me one-on-one and you're processing. I'm fine with that. But like in a group setting, I just didn't. So I'm sorry about that.
No, it's good.
Yeah.
When calls, when no one's participating, it always feels like an episode of Dora. So we have 15 minutes left, and I have a couple wrap-up questions for our panelists. And then I also want to return to one of the questions that was asked during the Q&A earlier that we didn't get to. So our first wrap-up question is, after getting to talk to all of these wonderful students, what excites you about the next generation of public health professionals? Whoever wants to start can go first.
I'm happy to go first because I'm very excited. As I said before, I've been very fortunate in just meeting all these wonderful people that like think like I do, and even those who don't think like I do, I'm like, still, I want to hear what you have to say. I just heard from so many of these wonderful students that they're like-minded, that they see people as people, and there's hopefulness there. And again, we all have that same goal, that same vision of people living the healthiest, most beautiful life that they can. So I'm very excited for their futures and am ready to help if they ever have any questions about corrections.
That's awesome.
I'm just excited to see that there are so many people that are interested in public health and actually want to pursue a career. You have to have a passion. You actually have to have a want to be able to do that and work with other people that could, possibly have chronic conditions and chronic illnesses. So I thank you. I applaud you. I appreciate you.
I think the thing that I've learned, not just here, but in sort of my lengthy 3-week public health career, is that as sort of the younger generation and sort of the way the world is evolving, it's nice to see that more and more of the discussions about underrepresented and underserved communities will come to the forefront, as opposed to sort of the database, the data approach that may not bear out, inequity versus equality, all these things about, it's not necessarily about the numbers. It's about, looking at the actual situations and finding ways to bring everybody to a level playing field.
Man, well said, Brian. I think I would echo that too. Like, I don't know, maybe every generation or mid-generation or whatever feels this way, but I think there's a shift. I think there's a shift happening in probably not just public health, but also public health, just in how things are addressed. And I think it's exactly what Brian said. I also think it's like that cross silo idea that public health is everywhere and is everything and belongs in everything. And I think that's really, really exciting. I think folks who are students now are gonna change a lot of things for the better.
All right, does anyone have anything else they want to share before I move on to the next question?
I was just going to say, when we zoomed back into the main room, we were talking about those upstream factors, and I was saying that when I used to teach, I would have my students kind of ask the question, but why? And they would have to ask it at least 3 times going backwards, because Brian was saying, instead of asking the what, we now have learned to ask the why. And one why isn't enough. kids aren't doing well in school. Why? Because they're hungry. But why? Why? Because there's no food access. But why? And so asking but why as many times as you can. The further we can go back, the more issues we can address with a single. I've heard a turn of phrase saying, "Feed two birds with one seed." Is how we say it now, I guess. And the greater impact we can have with more efficient work.
Okay, I'm going to move on to the next question. The next question is very general, if you want to make it general. What advice do you have for young professionals?
I guess I'll start. This is something that came up a little bit. Something I didn't realize when I was in school and like starting out, and even recently, like outside of work, my wife and I have started a podcast that's all about like, I had a bit more familiarity, my wife didn't, but like, what does the Soil and Water Conservation Board that we vote on, what does it do? Like we didn't know. So we started doing an interview podcast. And what I've found from that and what I've found from my professional life is that doors are way more open than you would think. I think I have pretty much 100% success rate for coffees, for informational interviews. Like you're in a field of people with people who want to mentor, who want to bring more people in. It never hurts to ask to, somebody who maybe even moved to a different field, but used to work in public health or, doesn't have that overt connection, but you learn bits and pieces and you start to see where the public health things are. And, I've often been in places where like, I can't see what my next job would be. It doesn't exist, but positions pop up and suddenly I realize I'm a good fit for it, or positions get created. And I think it's just really important to not have any sort of fear around reaching out and just being like, hey, do you have 20 minutes? Just, can I pick your brain or hear a little bit about your story?
Before anyone else chimes in, I think this would be a really great time to reiterate that we have that Google form going out for those one-on-one deep career conversations. So Felicia, if you could please send that out again, fill that out if you're interested. That was a good segue. All right, if anyone else has any advice they want to share, now would be the time to do it.
I told one of my groups, so I'm about to pull out some rainbows for those of you who have a tolerance for some touchy-feely talk, but here it comes. So two things. One is I've really tried, I have a silly name for this, but I've really tried to follow what I call like the hum of my soul. So I hope we all can recognize the feeling when we're doing something or engaged in something or spending our time and resources on something that just doesn't feel right. It's almost like a grating feeling inside. And then I think there's also a feeling that comes along with like excitement and intrigue and curiosity, and something that you just are naturally drawn to and want to know more about. And I think that following that as much as possible will get you to a good spot. I mean, or at least has the potential to. But of course, point two to that is I also recognize like what a privilege it is to even be able to have experienced that and have the ability to do that. So we need to keep that in mind too, that the ability to even be thinking about what do we want to do with our lives is such a privilege. But I think those of us, if we do have that privilege, just checking in and being true about what fits and what feels good and what direction is making our soul hum a little bit might provide some really good insight for a really rewarding experience.
I certainly have felt that privilege and appreciated it. And am glad that I did, was able to look around, and I think it's partly because I grew up in a family with some people who did jobs that they hated, you know, worked in factories and things, and it just wasn't, it's what they did to feed the family, you know, and I found this thing that was interesting, and I'm never going to get rich at it, but it's such a privilege, and I'm glad I recognize that. I don't know if that's soul humming or not, but
Sounds like it.
It's very Oprah, very much.
All right. Any last minute thoughts? All right, so with that, I'm going to wrap up today's session. We are on time, which is great. We haven't gone over. Thank you so much to our speakers for being here. It was truly an honor listening to everything you have to say. Thank you for your time. And to our students, fill out that form if you're interested in meeting someone. It's a great opportunity. Thank you for being here. Go public health.